Most people don't think of brain surgery as a fabulous, wonderful news, but in our case, it definitely was fabulous and wonderful news. And at least we have something to look forward to now, that something will change. Matthias is 18 years old. He has autism and developed what is considered medically refractory epilepsy 2.5 years ago. He had no history of epilepsy or seizure disorder at all, and one day we woke up and he was on the floor having a very long, massive, life-threatening seizure. He just continued to get worse, and he's lost his activities of daily living, his independence. He can no longer dress himself, brush his teeth, sometimes even eating. His gait is altered. He can't speak. He has a very profound stutter, cognition, every aspect of his life, to the point where, his quality of his life is very poor.
Intractable epilepsy is epilepsy that continues to occur in a patient despite taking therapeutic medications. My personal history with epilepsy surgery has involved caring for many patients who have autism. Kids who have autism and epilepsy together, which happens about 30% of the time, have a much more difficult time managing both conditions. Autistic behaviors are dramatically made worse in the setting of intractable epilepsy, and this becomes a nightmare on top of a very difficult situation for the families. For years we've been doing epilepsy surgery in patients with autism, but now Neuropace has given us an option that has been more successful and less invasive. Neuropace is basically a pacemaker for the brain. It's an implant that we use to modulate the brain's activity rather than destroy it. We place electrodes at the site of what we think is the epileptic network, and that is connected to a pacemaker that gets implanted in the skull. That device is capable of recording the brain waves, and then in response to when it detects a seizure, stimulate the brain to stop the seizure in its tracks.
The responsive neurostimulator detects the beginning of a seizure or a pattern that maybe could become a seizure, and then it delivers stimulation to stop the seizure from developing. One of the things that I see a lot is people are so fearful of having surgery, and what I don't think people are thinking about is the risk that they're taking every day by having intractable epilepsy.
We were really thrilled when they said to come to speak with Dr. Ghatan, because they had agreed to do the surgery. When you have run out of hope, it's a very powerful thing, just the hope part in terms of someone improving.
I'm very optimistic that other patients who have autism and epilepsy are going to benefit from this procedure. We've had numerous patients who've had a dramatic change in their behaviors, whereas before they were unpredictable and could be very aggressive, are much more engaged, much more capable of learning. These are major milestones in quality of life. We've had nothing but enthusiasm from those parents who have made the decision to go forward with this.